There's a condition that could be developing inside your head, or the head of someone you love, right at this very moment. And it's completely silent. It's called a brain aneurysm. And today we're going to break down what it is, and maybe more importantly, why finding one isn't always a death sentence.
So just try to picture this: a tiny pressurized water balloon inside one of your brain's blood vessels. That's really the best way to think about it, like a little ticking time bomb. And that's not just for dramatic effect. It perfectly captures the hidden danger of a weak spot under constant pressure from your own heartbeat every second of every day.
So what is this time bomb made of? Well, scientifically, a cerebral aneurysm is just a bulge or a balloon that forms in a weak spot on the wall of an artery in your brain. It's kind of like a weak patch on an old garden hose. Every time water pulses through, that spot stretches just a tiny bit more. It's a really slow, silent process, but it can have absolutely devastating consequences.
So that leads to the big question, right? How does this weakness even develop in the first place? Well, it turns out it's not random at all. It really comes down to physics and anatomy, all happening on a microscopic level inside that incredible highway of blood vessels in your brain.
It's all about location, location, location. See, most aneurysms don't just pop up anywhere. They almost always develop at what's called a bifurcation, basically a fork in the road where an artery splits in two. If you think about a river splitting, the point right in the middle, it takes the full force of the current, and that makes it the most vulnerable spot in the whole system.
Let's just walk through the process, step by step. So you've got blood flowing through the artery. Simple enough. Then bam, it hits that fork, which creates a ton of stress right at the split. Over time, that constant, relentless pressure starts to create a little bulge. And finally, over months or even years, that bulge can slowly grow into a dangerous aneurysm.
Okay, this brings us to something that is absolutely crucial to understand. Not all aneurysms are an immediate threat. They exist in two different states, unruptured and ruptured. And honestly, knowing the difference could literally save a life. So here's the wild part. A lot of us might be walking around with an unruptured aneurysm right now and have absolutely no idea. They are often completely silent. A lot of the time, they're only discovered by accident, during a brain scan for something else entirely. In fact, some estimates say that as many as 1 in 50 people has one.
But when an aneurysm does start causing symptoms, the difference is night and day. Let's say a large, unruptured one is pressing on a nerve. You might get some pain behind one eye, or maybe some blurred vision. Annoying for sure, but probably not an emergency. But if it ruptures, that is an absolute code red medical emergency. The number one sign is what doctors call a thunderclap headache, a sudden, unbelievably severe pain, often followed by nausea, a stiff neck, and confusion. This is a 911 call every single time.
Let's just sit with that for a second. Doctors, patients, they all say the same thing. It is the single worst headache of your life. It's this unmistakable, blinding pain that is your body's way of screaming that something is terribly, terribly wrong.
But here's the good news. If an aneurysm is found, whether it's ruptured or not, modern medicine has developed some incredible ways to fix it. There are really two main paths doctors can take to defuse this ticking time bomb. And here are the two different philosophies. On the one end, you have the traditional outside approach, open brain surgery where a surgeon puts a tiny metal clip on the aneurysm. And on the other hand, you have the modern marvel, the inside approach. Today, doctors can actually travel through your blood vessels, all the way from your wrist up into your brain to fix the problem from the inside without ever opening your skull. It's amazing.
And really, it's this inside approach that has been a total game changer. I mean, it is a massive leap forward, making what was once a super dangerous procedure dramatically safer, faster, and just so much easier on the patient.
So just how successful is it? Well, the success rate for these modern procedures is over 95%. Think about that for a second. For a procedure happening deep inside the human brain, that number is absolutely incredible, and it represents a huge safety net for patients.
And the benefits for the patient are just enormous. It's not just about avoiding open brain surgery. It means recovery is so much faster. Instead of weeks and weeks in a hospital, patients can be home in just a couple of days, and often back to their normal lives in about a week. It is a world of difference.
And this quote from Dr. Michelle Mad really gets to the heart of why this revolution even happened in the first place. The brain, it's what makes us who we are. It is an unbelievably precious and delicate organ.
So the entire goal of all these new techniques is to protect it at all costs, to solve the problem with the least amount of disruption possible.
So, we'll leave you with this thought. We've gone from these incredibly complex, open brain surgeries to minimally invasive procedures that can be done through a tiny little puncture in your wrist. I mean, technology that was basically science fiction not that long ago is now saving lives every single day. It just makes you wonder, what incredible breakthroughs are waiting just around the corner?